Everyone else, please, can you tell me how many sessions did you have with me?
This is my first class, ma'am.
Okay. And what else? How many people are in the class?
Ma'am, I think only 2 of us.
Okay, good. So this is the first. So the first is really on basics. So let's start somewhere basic. Okay. Gynecologist explains to the patient that HRT will not help her menopausal symptoms at this stage, but the patient insists to have it. What would you do? Refuse, give, refer. What do you think?
We have to refer her or refuse to give HRT.
Okay, so you think that we should refuse or refer. Okay, next.
Refuse to give HRT, ma'am.
Okay, very good. So here's the thing. There is something, this is the basis of medical ethics. There's something we call principalism. Okay. So what does it mean, principalism? You have 4 main principles in practicing medicine. Am I audible? Do you hear me?
Yes, ma'am. Yes.
Very good. So the first one is respect autonomy. Okay. Which means the patient should be the primary person who decides what they want to receive, what they want to have, what they want to omit. The patient should be the primary decision maker. Second, beneficence. It means you have to do everything on the patient's best interests. Okay. Third, non-maleficence, which means do no harm. And the fourth is justice. Okay. So the important part is that technically and based on the textbook, all these 4s are equals. They don't have any priority over each other. But usually in the practice is like this takes the first place. These 2 should be balanced against each other. And usually justice is the last thing that you think about. Has less implications. So when do we respect patients' autonomy? It's not like always you can respect the patient's autonomy. Example, a patient comes and tells you, I have end-stage cancer, I want to die, give me an injection. Would you do that?
No.
No. No, you cannot do that. That is not autonomy. That is not you. The patient's autonomy is on the table when there is something to choose. Euthanasia is not something to choose. It's not legal, it's not ethical in most of the countries. So that is not something to choose. So when there is something to choose, you respect the patient's autonomy. Example, You tell the patient, hey, you have cancer, you have to start chemotherapy. These are the benefits, these are the risks. Do you want to take chemo? The patient tells you the patient is competent, no problem. Mature, the patient tells you, no, I want to enjoy my life as short as it is. Can you respect this patient's wish?
Yes, ma'am. Yes, yes.
Yes, very good. Yes. So respecting patients' autonomy is when there is something to choose, 2, 3, 4, 10 options. The patient tells you based on my situation, based on my preferences, I want to choose this option. Fine. But sometimes there is nothing to choose. Okay. So here you know that HRT is not medically indicated. So is there a choice to be made? Yes or no? Hello. Do you hear me?
Ma'am,
Yes,
I can hear you now, ma'am, but I couldn't hear you before that.
Okay. I'm saying that this patient, you know that there is no medical indications for giving this patient HRT. Okay. So is there a choice for the patient here?
no, ma'am.
No, ma'am.
No, there is no indication, no choice. Okay. Example, you can tell the patient here that there are some medical treatment, some other medical treatment, some lifestyle modification. You can choose between these. But HRT is out of the question. So no respect the patient's autonomy because there is no autonomy here. Okay? And you give the patient, did you help the patient? No, because you know that it's not going to help with the patient's symptoms. You give this patient, did you harm the patient? Yes, because there is a long list of side effects. So what you do?
Refuse.
Yes. You refuse giving the patient. This is called principle. You are struggling with, you can use these 4 principles to justify your actions. Another question. You're telling a local patient who just had an MI 2 weeks ago that they should stop smoking, try to lose weight, and cut off on alcohol due to their advanced coronary artery disease. The patient has before seen you smoke and drink, and you also have some extra weight on. So he gets angry and tells you harshly that how dare you tell him to do stuff that you yourself do not. Are doctors bound to be role models for the patients? A, no, medicine is a profession, not a lifestyle. B, yes, patients take advice better from someone who is doing things right. C, not at all, because patients take advice better from someone who is dealing with the same problems. What do you think? Any idea?
Answer A.
What?
No, medicine is a profession, not a lifestyle.
Okay, so one person thinks it's A. But the others think,
Ideally, it should be A, but I'm not sure about it, ma'am.
okay, so we are talking about ideals. This is a session, not in practice.
Sorry, ma'am. I don't know, ma'am.
Yeah, no problem. Okay, so yes, here's the thing. Yes, the answer is A. Medicine is a profession, it's not a lifestyle. Actually, options B and C are kind of correct. Some patients take advice better from someone who is dealing with the same problem. Sometimes patients take advice from someone who's doing things right, okay? But you are not bound to do life. You should have a specific and clear border between your personal life and your professional life. And you should keep things separately, okay? In your personal life, you might be doing anything you want unless and until they affect your professional life, and you have to keep your professional somehow that you can have a personal life too, okay? So no, you are not bound to make changes on yourself, on your personal life, just as an educational, pedagogic purpose to keep your patients better. No, you are a professional like any other professional, like an engineer, like a teacher, like any other person, and you have a personal life which is completely yours, and you have a professional life which you dedicate to help people. Clear?
Yes, ma'am.
Very good. Next, a patient comes to you with complaint of not having a bowel movement for the last 2 days. She's a 25-year-old man with no known medical condition. You want to do a rectal examination and she asks for a lady doctor. As there is no lady doctor, she consents to go through the PR exam. You diagnose her with constipation and send her home with Senna tablets. After a few days, her husband comes and complains to the HOD about inappropriate examination. What should you have done? A, nothing differently as there was no lady doctor available. B, called for a chaperone. C, nothing differently as it was an emergency. What do you think? What do you think?
Ma'am, we should have called for the option 2.
Option 2. What is your name?
Ma'am, I'm Yeril Madana.
Very good. Dr. McKenna thinks that we should call a chaperone. The next doctor, what do you think?
Ma'am, actually, I don't know what is the meaning of chaperone. So
A
can you please?
chaperone is someone, a professional person who keeps company to the patient, records everything, you know, for just making sure that everything is professional and, you know, nothing fishy is going on.
That means the person is a staff in the hospital?
In some countries, you have trained professional chaperones. Like in UK, you have people who are trained to be medical chaperones, okay? But in other situations, like here in the Persian Gulf countries, usually the nurses do the chaperone job too.
Okay. So I'm also going with the answer B, ma'am, to call for a
Very good.
chaperone.
What is your name?
Nasmin.
Very good. Dr. Nasmith also thinks that we should call for a chaperone. So are there only the two of you in the class?
Yes, ma'am.
Very good. There are 5 participants though.
No, I think There is another person.
Yeah. Okay, okay, fine. Yes, Dr. Azil and Dr. Zafar Nisa. Okay. So, yes, the answer is this. So here's the thing. When a patient comes to you, in cases of emergencies, you can go on without the chaperone, or if the patient, you have to, of course, you have to talk to the patient, but you can go for the opposite sex patient too, opposite sex doctor too. In cases of non-emergencies, either you have to provide the patient with the same-sex doctor if the patient asks for, or you have to have something for the legal reasons and ethical reasons. Okay, so here's the thing. Always when the patients are about to have an intimate examination, you have to offer a chaperone. If the patient declined the chaperone, is fine. Many patients say, no, I don't like a chaperone. Fine. You document that I offered the chaperone, patient said no, and you go on without the chaperone. If it's an emergency, you can go on without the chaperone, but you have to be sure that it's an emergency. Like in this case, this is not an emergency. Okay, this is just a constipation. Patient's abdominal examination is fine. If your patient showed signs of a perforated bowel or something, yeah, that would have been an emergency. Now it's not an emergency. Okay, so you should have called the chaperone. If it's an emergency, go on. So what are the intimate examination? Breast, genitalia, and rectum. Next, you are the only doctor in an emergency room which is very busy. You have one MI and one severely injured motor vehicle accident patient at the same time. A third patient comes in with superficial cuts from a street fight. He has been explained to multiple times by the nurses that you are busy with more serious patients and he will be seen by the doctor ASAP. After 10 minutes, he loses his temper and starts yelling and cursing. The nurse explains to her that if he continues such a conduct, he will be excused from the OR and escorted out by the security guard. After another 15 minutes, he starts to yell again. When the nurse attends him, he pushes her away and asks for the doctor. Are you obligated to treat this patient? A, yes, all the patients should be taken care of no matter what. B, no, all the violent patients who are putting other patients and colleagues should be dismissed. Yes, since he's under physical pain. D, no, as he was informed of the consequences. And E, yes, as now it is an emergency and the consequence of not treating him will be more serious. What do you think?
Option A, yes, all the patients should be taken care of.
Very good. What do you think?
Or because that would be the justice, ma'am, or principalism.
Very good. So the next doctor, what do you think?
Yes, ma'am. Option A is all the patients should be taken care of, no matter what.
Well, here's the thing. No, it's not. Okay. There is a contract between a doctor and the patient. Okay. I treat you no matter what, you will not be violent. Okay. Here's the thing. Do not forget, as you have a duty towards your patient, you also have a duty towards yourself and your colleagues. Okay? This patient is sane, awake, and not a case of emergency. In these cases of violence, especially physical violence. If you already informed the patient that if you continue like this, our contract is loose and done and no more obligating. If the patient continued, that was the patient's autonomy. The patient chose not being treated by you. Got it?
Yes, ma'am.
Very
Yes,
good.
ma'am.
Very good. So here, no, you are not legally binded to treat this patient because he was informed of the consequences. So what is the answer?
Option D.
Very good. So here's the thing. A doctor's duty of care is not limitless. You have duties to other patients, you have duties to yourself, and you have duties to colleagues. An aggressive patient who has been informed that he will not be provided and the patient made the choice to continue, that was the autonomous choice. So done. So, and also you have a duty, your duty to the patient should be balanced against the harms that the patient is making to other people, except in very severe emergencies. Otherwise, if your patient being violent, you are done with the patient. Got it?
Yes, ma'am.
Very good. Next question. You are the only doctor in an emergency room, which is very busy. You have one, it seems that the meeting will be done in 2 minutes. What should we do? The meeting time in Zoom.
Ma'am, we should open a new link and join again, ma'am, because
I'll send you a Google Meet link. Okay? Join me in Google
okay.
Meet.
Sure, ma'am. Yes, ma'am.
I'll send it right now in the
Thank you, ma'am.